A very good morning to all the panelists and participants. GMR Division NIDM, and I am the moderator of today's webinar. On behalf of National Institute of Disaster Management, Ministry of Home Affairs, I welcome you all to today's webinar for COVID-19 appropriate behavior. The aim of today's webinar is to foster the Jan Andolan initiated by Honorable Prime Minister of India against the COVID-19. Honorable Prime Minister of India, Shri Narendra Modi, launched a Jan Andolan campaign on COVID-19 on 8th October 2020. Jan Andolan campaign is a low-cost, high-intensity campaign driven by the people's participation for dissemination throughout the country using all media platforms. The campaign emphasized on unlock with precaution, that is, COVID-19 appropriate behavior in the new normal. The three key messages being highlighted: follow physical distancing and hand hygiene. The highlight of the campaign is the partnership and concert efforts of central government ministries, departments, and states and union territories governments along attached and subordinate officers, so that the campaign can reach to each and every citizen of India. Today, there will be two sessions in the webinar, inaugural and technical one. The inaugural session will be graced by the presence of Professor Surya Prakash, Head GMR Division NIDM. And for technical session, we will be having speakers, namely Dr. Harjeet Kaur, Young Professional Center for Coastal Disaster Risk Reduction and Resilience, GMR Division NIDM, Mr. Raju Thapa, Young Professional Center for Early Warning and Communication, GMR Division NIDM, and myself. Now, I request Professor Surya Prakash, Head GMR Division NIDM, to set the context of today's webinar through his keynote address. Over to you, sir.
Thank you, Anil. Am I audible?
Yes, sir, you are audible.
Okay, first of all, my heartiest welcome to all the speakers and the delegates for today's program. Today we are going to join with the Prime Minister's Jan Andolan, the mass campaign that has been initiated on 8th of October, Thursday, 2020 by the Honorable Prime Minister himself through a tweet. So we are going to join, and I would request all the delegates also that actually released a pledge to all the people to their actions against COVID-19 by following the three golden rule formula that needs to be followed to contain and control the spread of COVID-19. My colleagues from MR division, they will be sharing the cautions and the fact measures to be taken up in workplaces, at your houses, as well as during your travel, so that the spread can be minimized and the risk can be reduced to a great extent. And these guidelines, recent guidelines, will also be shared by our colleagues with all the participants. With these words, I thank you all for joining with us, and also thank our distinguished speakers who had prepared their presentations in this COVID-19 situation, when there was no other way but to communicate online digitally. So I wish all the best for the program to the speakers as well as all the delegates, and expect active participation from both the sides. With these words, thank you very much. And as Honorable Prime Minister said, mask पहनना, हाथ धोना, को टच नहीं करना, और 2 गज की दूरी है बहुत जरूरी, को फॉलो करें, और इसमें इस जो वैश्विक महामारी है उसको नियंत्रित करने। इन्हीं शब्दों के साथ मैं आप सबका धन्यवाद करता हूं और अपनी बेस्ट विशेस सबके लिए समर्पित करता हूँ। धन्यवाद।
Thank you,
Anil,
sir.
to you.
Thank you very much, sir, for setting the ambience for the webinar through your insightful derivation. That's all for inaugural session. Now we move ahead for today's technical session. I request all the participants for their active participation in the technical session through their questions, which they can raise through Q&A box. And after each presentation, we will be taking your queries to the respective speaker. In context of current unlocking phases, one of the crucial questions is the safety of people at their workplaces. And to discuss it in detail, COVID-19 appropriate behavior for workplace, I hand over the mic to Mr. Raju Thapa, Young Professional Center for Early Warning and Communication, GMR Division, NIDM. Prior to joining NIDM, he has worked as research fellow in Department of Science and Technology, Science and Engineering Research Board, and Board of Research in Nuclear Science. Mr. Raju Thapa has spent more than 40 research publications and book chapters in some of the leading journals. His expertise in the field of remote sensing and GIS and its application to water resource contaminant hydrogeology, groundwater potential mapping, and landslide assessment. Over to you, Mr. Raju.
Am I?
Raju, your voice is breaking. Your voice is breaking. You can
Okay, okay. Now is it okay, sir?
Now it's okay.
Okay, okay. Thank you. So good morning and namaskar. So first of all, on behalf of NID, I welcome all the participants to today's webinar. So, our moderator of the day highlighted that coronavirus disease, that COVID-19 we say, is a very infectious disease caused by the newly discovered coronavirus. Like most people infected with the COVID-19 viruses will experience mild to moderate respiratory illness and recover most of the time without requiring special treatment also. But however, older people and those with underlying medical problem like cardiovascular disease or the diabetes or the chronic respiratory disease and cancer are more likely to develop serious illness. So and one more important thing is office and other workplace are relatively like closed settings where like with shared space, like in office we share corridors, we share elevators, stairs, parking places, cafeteria, or the meeting room or the conference hall. All this we have to share, and thus COVID-19 infection can spread relatively faster among officials or staffs and visitors. So thus there is a need to prevent importation of the infection in workplace setting and to respond in a very timely and effective manner in case suspected case of COVID-19 is detected in these settings, so as to limit the spread of infection. In this regard, Government of India, Ministry of Home Affairs, Ministry of Health and Family Welfare, Director of Journal of Health Service, that EMR division we say, they have laid down guideline on preventive measures to contain spread of COVID-19 in the workplace setting. And in this, in the document that they have shared or outlined, published, they have outlined the preventive and response measures to be observed to contain the spread of COVID-19 in workplace setting. This document is broadly divided into 4 subsections, that is basic preventive measures to be followed at all time, like whether you are in office or out of the office. And the measure is specific to office, measures to be taken on occurrence of cases, and disinfection procedures to be implemented in case of occurrence of suspected or confirmed cases. Let us discuss all these subsections one by one in detail. So the first one is the basic preventive measures. So the basic preventive measures include simple public health measures that are to be followed to reduce the risk of infection with COVID-19. These measures needs to be observed by all employee and visitors, and at any time. This include like physical distancing of at least 1 meter to be followed at all time, just like our Professor Surya Prakash has highlighted just now. Use of face mask and face cover it's very mandatory to use in the office setting. Practice frequent hand washing for at least 40 to 60 seconds, even when hands are not visibly dirty. And use of alcohol-based hand sanitizer for at least 20 seconds should be encouraged. And especially respiratory etiquette should be strictly followed, like the involved strict practice of covering one's mouth and nose while coughing and sneezing with a tissue paper or handkerchief, and now flexed elbow also, and disposing of used tissue properly. So these things should be practiced. And also self-monitoring of health, that is also a very important issue by all, and reporting any illness at the earliest, whether in to the officials. So this is the office memorandum that has come up, and you can go through this at Ministry of Home, like MHW, the given website. And the second point that is and one more thing, that the guidelines with respect to the preventive measures specific to office has been issued by the Department of Personnel and Training Guidelines. So you can have a look there. So, and regarding the preventive measures for offices, any staff that is reportedly suffering from flu-like illness should not attend office and seek medical advices from the local health authorities. Such person, if diagnosed or suspected or confirmed case of COVID-19, should immediately inform the office authorities. Any staff requesting home quarantine based on the containment areas activities, like in their residential area, should be permitted to work from home as much as possible. And also a Department of Personnel and Training Guidelines with respect to organizing meetings, coordinating visitors shall be followed in a very careful manner, very careful and thorough way. So right now the webinar that we are attending is also you can say a follow of the protocols that has been laid down by DOPT. And if you talk about the measures to be taken, suppose after that also, if there are some cases of occurrence of COVID, so what can be done? So despite taking the above measures, the occurrence of cases among the employee working in the office couldn't be ruled out. So considering two conditions, that is, first, when one or few are suffering, and if a large number are suffering, contexts are there. So the following measures will be taken in such circumstances. When one or few persons are suffering, you can isolate that person in a room or area, and close office space in, and you can isolate them, and also place that ill person in a room or area, and provide a mask or face cover till such time he or she is examined by a doctor. Report to the concerned central state health authority, and after risk assessment by proper health authority, further advice should be made regarding management of the cases, like his or her contact tracing, and need for disinfection. The suspected case, if reporting very mild or very mild symptoms on assessment by the health authorities, it would be put under home isolation, subjected to fulfillment of the criteria laid down by in MHFW guidelines, like Ministry of Health and Family Welfare. And if the suspected case, if assessed by the health authorities as moderate to severe, he or she will follow the other set of guidelines that has also been laid down by the ministry. So this is in case of if in office there are 1 to 2 cases, COVID positive cases. What if there are a large number of contact from a pre-symptomatic case? If this could be possibly a cluster emerging in workplace setting. So due to close environment in workplace setting, this could even be a large cluster, more than 15. If the person infected if he has come in contact with others, so this could be a large cluster also. The essential principle of risk assessment isolation and quarantine of contact, case referral and management will remain the same as in one or two cases. However, the scale of arrangement will be very higher in this case because the number are very high. So if you take the high risk, if you take the high risk contact, shall be like those people who are in high risk, they shall be quarantined for 14 days, and this will be followed in they will be following the guidelines of home quarantine laid down by MOSWF. And those person who are in not in direct contact with that, and those are who are in low risk, I will share later on who are high risk and who are low risk people. So those people who fall under the low risk exposure, they shall continue to work, and but they should keep a very close monitor of their health for the next 14 days. And if you take the algorithm for isolation of suspected case, it could be both like suspected case directly reporting to the COVID dedicated facility, or screening at fever clinics. So both these, they are the suspected cases of COVID-19, and based on their treatment, based on their symptoms, whether they have the mild and very mild symptoms, or they have the moderate symptoms, or they have the severe symptoms, they are categorized. Further on, these categorized, they are tested. All of these are tested for the COVID-19, and upon the output of that test, for both negative and positive, specific guidelines and instruction has been laid down. So this you can also go through in the Ministry of Health and Family Welfare. So for each conditions that can arises from your testing to the last step, everything has been laid down. So now, like I have said, I will discuss who are high risk and who are low risk. So high risk, basically the contact are those who have touched the body fluid of the patient, like suppose the respiratory tract, or the blood, or the vomit, saliva, urine, sharing of the toilet, like the washrooms and all. That's why. So even because being coughed on, or touching used paper tissue. So all these points will make the person in a high risk category. Similarly, having direct physical contact with the body of the patient, including physical examination without PPE, or the touched or clean the clothes or dishes of the patient, living in the same household as the patient, anyone in close proximity within 1 meter of the confirmed case without precautions, and the passengers in close proximity within 1 meter in a convenience, with a asymptomatic person also, which later tested positive for COVID-19 for more than 6 hours. So all these persons who are coming in contact with the infected person, they are in high risk zone. However, sharing the same workspace, same room, similar, but not having a very high risk exposure confirmed, if they are not coming in direct contact with each other, and also if they have the specific distance among them, though they are traveling in the same environment, they are placed in low risk contact. But however, as I have told you, even though you are in low risk contact, you have to monitor yourself for the 14 days. So, and you have to check whether you are showing any symptoms of COVID-19. And if you do so, then you have to report it immediately to your higher authorities. So closure of a workplace. So suppose if there are, like we have discussed, if there are 2 or more cases reported, then in your office area, then the disinfection procedure will be limited to places area visited by the patient in past 14 years for 48 hours. There is no need to close the entire office building. And work in other areas of the office, and work can be resumed after disinfection as per laid down protocols. They have also laid down protocols how to carry out the disinfection. However, if there are a large outbreak, the entire building will have to be closed for 48 hours, and after thorough disinfection, all the staffs will work from home till the building is adequately disinfected and is declared fit for the reoccupation. So, and the detail, if you want to know the detailed disinfectant procedure in office, this has been laid down by the Ministry of Health and Family Welfare, and you can go to the website and you can check the detailed instruction how to carry out the disinfection in your office, in your washroom, in your toilet, what kind of agents should be used, what are the chemicals that are prescribed. Everything is given in this guideline. You can go and have a look at this. The following guideline has to be filled, especially in area reporting COVID-19. And this is for both indoor areas, outdoor areas, and also the public toilet, as I have mentioned. So if you talk about the duties and responsibilities of all the employees or the workers, see, all the employees and workers and their organizations should collaborate with health authorities to prevent and control the COVID-19. See, the cooperation between management and workers and the respective and the representative is very essential between management and workers, and the respective is essential for workplace related to prevention measures, and also staffs in consultation with workers and the representative should plan and implement measures to prevent and mitigate COVID-19 at the workplace through engineering and administrative control, and providing basic personal protective equipment and clothes according to the risk assessment. Like such measures should not involve any expenditure on the part of the worker. And also special measures are needed to be needed to protect the worker at high risk of developing such disease, such as those elderly workers, or the people who are specific suffering from some diseases that can that make more susceptible to COVID. So these type of people, we should treat them especially, and upon recommendation, and also worker in the informal economies also, and digital labors platform, those in the small enterprises or the domestic and the migrant workers should not be left behind in the protection of their health and safety at work and also at their livelihood. And one more important thing is during the COVID situation is that the most of the people, those who suffer from COVID-19, they face the social stigma. So this should not be encouraged. This should be discouraged. There should be no social stigma or discrimination at the workplace for any reason, including access to information and protection from COVID-19 or the occupational health services and the mental health services and all the psychological support. This thing is very important, and this point has been highlighted in several international issue also, like the World Health Organizations also. They are continuously promoting we shouldn't support the social stigma, because the person who is suffering from COVID is already under mental stress, and if we treat them differently, then it will result in rather more deterioration of their health. So we should check there shouldn't be any social stigma. And also the staff are responsible to follow the measures for occupational safety and health and infection prevention, and also a control establishment for the workplace, and to participate in training provided by the employer. The workers should report to their supervisor if any situation would arise may present an imminent and serious danger to their life or health. So if they show any signs, any symptoms, they should immediately report to their supervisors or to their head, and they should take the necessary precautions, starting from home quarantine themselves to other measures that has been laid down. So with this, I end the presentation. Thank you very much for this.
Thank you. Thank you very much, Raju, for highlighting the appropriate behavior at workplace. There is one question for you.
Yes, sir.
How can people assess the risk for exposure to COVID-19 in their workplace and plan for preventive measures?
Okay, like we have already discussed also, like what are the, you first of all, you have to identify the risk. Suppose, let me take both the, like three different examples, like low exposure risk, medium exposure risk, or the like high exposure risk. So what happen is, suppose all the different, I mean to say, like managers with the support and occupation health and safety advisors, like they should carry out rapid assessment to determine the possibility of exposure risk in order to put in place like preventive measures. Before putting out preventive measures, we should know what we should know the assessment, risk assessment. So like suppose low exposure risk, like job or work without frequent close contact with the general public or others, like you can say work from home people, like those who are doing work from home, such people, they are in low exposure risk, so you can plan differently for them. Similarly, like medium exposure risk, like a job or task with close frequent contact with the general public or others, like this risk level may apply to workers who have like frequently and close contact with the people in like high population density work environment. Example, you can say the food market or the bus station or the public transport, and other who are working where like physical distance of at least 1 meter may not be practically possible. So, but we can assume them as a medium exposure risk, or tasks that require very close or like you can say frequent contact with co-workers. Those who are working in retails, who are those persons who are working in home deliveries or the accommodation or the construction, police, you can say security, public transport, water sanitation. These type of people, you can place them in medium risk people, and you can plan your prevention and prevention, like prevention ideas accordingly. And the last category that I was saying was the like high exposure risk, like those people who are actually dealing with the COVID people, like suppose job or task with the close contact with people who may be like more likely having COVID-19 or the COVID patient, as well as with object and surfaces possibly contaminated with the virus. Like you can take the example of the driver, like ambulance drivers, and also the like domestic services or the home care for the COVID patients, and have like, and also like people who are dealing with the decreased, with the known or suspected of having COVID-19 at the time of like their job, that may even fall under this category, include like the domestic worker also, like the social care worker, the personal transport worker, and also home delivery. So plumber also you can take, electrician you can take. So all these, they come under high exposure risk, and accordingly we can plan in a similar manner. Thank you, sir. Over to you.
Thank you very much, Raju. The next presentation will be taken by myself. Raju, can you please give me the presenter? Okay.
Yes, sir. You have been assigned, sir.
Thank you very much. Let me share it. Raju, inform me as soon as my PPT are visible.
Sir, it is visible, sir. It is visible, sir.
Okay, thank you.
Okay, sir.
So very good morning to all of you. I will be talking about COVID-19 behavior for perspective of domestic helpers. But before that, as per the mandate of NIDM, it is my responsibility to remind you all that our battle against COVID-19 pandemic is not over. We are gradually coming to our old routines through various unlock guidelines, but we not to forget that still there is no vaccine, no drug to counter COVID-19. So there should be no place for carelessness. I, on behalf of National Institute of Disaster Management, request you all to kindly follow all the precautionary measures for COVID-19. Good hand hygiene, wash hand with soaps, water for 40 seconds frequently, especially after you have been in a common area or after blowing your nose, coughing or sneezing. If soap and water is not available, then use alcohol-based sanitizer for up to 20. Don't touch your eyes, nose and mouth. Practice good respiratory hygiene. Use face cover or mask, following cough etiquettes, and avoid spitting in public places. Wear mask properly so that your mouth are fully covered. Don't use a mask for more than 8 hours, and maintain physical distancing. As said by Prime Minister, दो गज की दूरी है बहुत जरूरी. Maintain distance while interacting with other. Don't shake hands, pat the back or hug other person. Ensure supportive environment. Ensure that any stigma related to COVID-19 is dealt with, and proper cleaning of frequently touched surfaces. Now talking about the population of domestic helper in the country, the number of the domestic helper in India range from officially estimate of 4.2 million to unofficially estimates of more than 50 million. Girls and women make up significant majority of these helpers or workers. Two-thirds of the all domestic helpers in India were employed in urban areas, and as per an estimate, around more than 1.8 lakhs children are employed as domestic help in and around dhabas that are around the small roadside eateries. The majority of the domestic helpers are illiterate, minimum low skill. They are also one of the poorest and most exploited groups of workers in the country. They are forced to dependent on their employers due to their situation of poverty, illiteracy, and low skills. What of COVID-19 on these domestic helpers? Due to COVID-19 pandemic, many faced job losses, losses in stability and pay cuts. When the coronavirus started to spread and restrictions on movement were introduced across the country, housing complexes and gay communities banned the entry of domestic helpers. Even today, as the lockdown has been gradually lifted, many domestic helps continue to struggle. Many have not been able to because employers no longer want the workers in their house, fearing they would spread the disease. Some are back, but partially. There has been a big change in the attitude of our employers. Now, they are seen as a potential carrier of a virus. During the lockdown, central government released a public advisory urging employees to pay their domestic helpers for the period that they were. So, because of the movement, restriction of movement was imposed. However, as this was not enforced well in any manner, the vast majority of domestic helpers or workers received only partial payment or no payment. They had to rely on emergency provision from the government or NGOs, civil societies for food and other essential things. Many families were pushed into exhausting all their savings and become indebted. According to an article published in vigo.org that was by Ms. Malvika Narayan, apart from non-payment of dues, many domestic helpers expressed shock about the way the employers have started to treat them, for whom they had cared for many years. They abandoned them in a time of distress. Many stopped taking workers' calls and did not reassure them that they would be taken back when work would be resumed. While some workers were asked to move to the employer's house, many were unable to do so. It was unclear whether those who did were paid higher wages to account for the longer hours of work they were not putting in, or whether living workers got adequately compensated for the increased work burden due to all members of the employer's family being at home the entire day due to lockdown. Eventually, as cities began to reopen, domestic helpers were faced with hopes of fresh problems. In spite of government measures, many housing society apartment complexes were not willing to allow access to domestic workers due to discrimination about the poor as dirty and carriers of disease. In place where they were let in, there were reports of discriminatory practice subject to dehumanizing order of being disinfected, being involved in cleaning work and even shopping for their employees. These workers are at higher risk of infections. Institute of Social Studies Trust conducted a study on impact of COVID-19 national lockdown on women domestic workers in Delhi. And according to the report, 54% of the domestic help reported that they could not collect their salaries owing to sudden lockdown and restriction of mobility, while 14% reported fear of coronavirus not being able to collect their wages. As a result, almost 83% women reportedly faced severe to moderate economic crisis in their family. However, some of the leading helpers reported no impact on salaries as they were living with their employers, and some employers who anticipated the lockdown did pay advance salaries for to their part and domestic workers. Since the lockdown have been as a result, 54% of domestic workers reported increased domestic work burden as cleaning, cooking, washing, and so on. 23 stated that time spent in arranging for food and other essentials. 20% reported increased caregiving, and 14% stated time spent in collecting water. With regard to sharing of the household work, 54% reported that help, no one helped them, while only 14% reported that their spouse, their better half had. Women living in household with more number of family members reported increased in unpaid work burden during the lockdown. Food insecurity for the poor has been a paramount concern during the national lockdown. 44% of the domestic helpers received dry ration from PDS shops, followed by some grocery being bought at the local kirana stores. Almost 51% of women share that the price of the items like vegetable, food, tea, sugar, etc. has gone up significantly, and they did not have enough money in hand to afford these items. Water storage and water shortage and cramped living space make hand washing and other safe practices difficult for them, and hence expose the vulnerable further to infection. Further, in these uncertain times, communication is vital, and almost 34% of helpers face problems charging their phones because of loss of income and because of shops were being closed. Helpers also complained of challenges in assessing health services and essential medicine because of closure of OPDs in hospitals and private clinics. Restriction on mobility and lack of income was also the reason to access proper health services. With the entire health sector and available funds being allocated towards controlling the pandemic, as a result, there is severe lack of focus on women's reproductive health services as well. As such, many women have been forced to give home births, risking infant and maternal mortality rate. Another major concern has been brought housing and house rent. Most of domestic helpers families are migrants, and despite of government notice urging landlords to not ask for rents, many domestic helpers complained that they had to pay some amount as rent, which they managed from their savings. Around 43% were concerned about continuous loss of income as well. The stigma and discrimination. This social stigma and how it is different from discrimination. In the context of health care, stigma is when any person or community sees someone in a negative way because of his illness, his or her illness. When a person is labeled by their illness, they no longer see as an individual but as a part of stereotype group. Negative attitudes and belief toward this group leads to negative actions and discrimination. Discrimination is when a person or community treats someone in a negative way because of his or her illness. In context of this disease outbreak, this means people are labeled, people are stereotyped, they are discriminated against and treated separately because of a perceived link with a disease. Such negative treatment can affect those with the disease as well as their caregivers, family, friends, communities. The current COVID-19 outbreak has provoked social stigma and discriminatory behavior against anyone perceived to have been in contact with the virus, such as doctor, nurse, and other frontline workers. So there needs to be change. Advocacy. Advocacy means to identify an issue and call for change. Advocacy is also about making voice heard, as often the ideas of practice we want to change affect the most vulnerable people in society. Advocacy uses this collective voice to defend and protect rights or to support different initiatives or causes. Change can be advocated at multiple levels, such as it can be advocated at individual level, it can be advocated at local level, for example, by local governments, local police, religious leaders, school system, and at national level by central government or ministries or departments, or as well as at international level, for example, by agencies or other international NGOs or organizations. Advocacy can bring about change in policies, program, actions, mindsets, behavior, institutions, and as well as investments. We have to remember that we are not asking for any favor. We are asking people to do something right. There are certain do's and don'ts for domestic helpers that are staying with their families of the employers. Um, they should be to follow proper hand hygiene. He or she should wash their hands, sanitize every time she go out for essential items. During the day, she should be told to wash her hands slowly and frequently with soap and running water. Maintain a safe distance with domestic help. Don't stay very close. Help to direct him or her all the time or any instructions. If she or he is having any symptoms of corona, they should not be asked to isolate or home quarantine. If she is having any symptoms of corona, they should be taken for testing and medical checkup immediately. We should provide them with necessary support for getting medical help immediately. It is the responsibility of every employer who is having any domestic help or domestic worker to take care of those, care of their families. So let's follow this 15 COVID-19 appropriate behavior to flatten the graph of COVID-19 and win our against this pandemic.
Hello, Anil sir. So there is no audio in the video, right?
No, no, there is no audio.
Okay, sir.
That's all from my side. If there will be any question, I will be taking it after the next presentation. And for next presentation, I hand over the mic to Dr. Harjeet Kaur, who is working as a professional in nutrition disaster management. She is currently working in coastal disaster risk reduction and resilience center in GMR division of NIDM. And prior to this, she was working in landslide risk management in Gangtok, Sikkim. Dr. Kaur has published over 16 research publications in various reputed international journals. She is also recipient of a number of awards. She is professionally recognized such as Young Scientist Award, Gold Medalist in GMPG studies, as well as Inspire Fellowship and so on. And she will be discussing the latest unlock guidelines released by Ministry of Home Affairs. Over to you, Dr. Kaur.
Thank you, Mr. Anilji, for brief introduction. Before starting my presentation, I just want to share, because I have seen in the chat box that some of the participants said that NIDM give some suggestion that we have to conduct this type of webinar on the month of June or July. So I want to say that NIDM is rigorously and continuously we are conducting the webinar and training, and in the month of June we had conducted a webinar series on COVID-19 precautions with WHO. So now we are conducting this as you already know that recent guidelines are issued, so it's our duty and mandate to aware and conduct webinar on Jan Andolan for COVID-19. So I hope this answer will satisfy your comment or the suggestions. Now, moving to my presentation. As all we know that our country is at critical juncture in its fight against COVID-19. The number of active cases has declined steadily over the last 2 months, from over 10 lakhs on September 18, 2020 to less than 4.5 lakhs now. However, over the last few weeks, the number of new cases has been rising in some states and UTs. The confluences of certain factors like the recent festival season and the onset of the winter and the laxity in observation of the COVID-19 guidelines issued by the Ministry of Home Affairs in certain part of the country pose the risk of the situation becoming aggravated, thus putting a strain on the health infrastructure. Over the last few months, economic and other activities have been opened in a phased manner, with the stipulation that prescribed standard operating procedure, that is our SOPs, be followed. And however, there is a commitment need to exercise due care. Every citizen must adopt COVID-19 appropriate behavior so as to ensure that the resumption of activities is successful and gain made in the management of pandemic are not negated. MHA has released new guideline on surveillance, containment and caution on 25th November 2020. Whereas an order of event number dated 30 September 2020 was issued for the containment of COVID-19 in the country for a period up to 31st October, which was further extended for the period up to 30 November. The following guidelines, the recent, are issued to be effective from 1st December 2020. So, first is COVID appropriate behavior, what the state government or UT should do. The state and UT's government shall take all necessary measures to promote COVID-19 pandemic and COVID-19 appropriate behavior. Strict enforcement of wearing of face mask, hand hygiene and social distancing must be ensured. Wearing of mask is an essential prevention measure. In order to enforce this core requirement, states and UTs may consider administrative action, including imposition of appropriate fines on person not wearing face mask in public and work spaces. Observance of social distancing in crowded places, especially in markets, weekly bazaars and public transport is also critical for containing the spread of the infection. Ministry of Health and Family Welfare, as my colleague Mr. Raju Thapa have already mentioned, so they have issued an SOPs to regulate the crowd in marketplaces, which shall be strictly enforced by states and UTs. Now, the surveillance and the contaminant zone. First, we should demarcate the contaminant zones in and high incidence areas is a key to breaking the chain of transmission and controlling the spread of the virus. Contaminant zone shall be carefully demarcated by the district authorities at the micro level, taking into consideration the guidelines prescribed by the Ministry of Health and Family Welfare in this regard, and the list of contaminant zone will be notified on the website by the respective district collector and by the states or the UTs. This list will also be shared with Ministry of Health and Family Welfare. Then within the demarcated contaminant zone, contaminant measures as prescribed by the Ministry of Health and Family Welfare shall be followed as under, like first we have to only essential activities shall be allowed in the contaminant zone. There shall be a strict perimeter control to ensure that there is no movement of people in or out of these zones except for medical emergencies and for maintaining supply of essential goods and services. There shall be intensive house-to-house surveillance by the surveillance team formed for the purpose, and testing shall be carried out as per prescribed protocol. Listing of contact shall be carried out in respect of all persons found positive, along with their tracking, identification, quarantine, and follow-up of contact 14 days. 80% of contact to be traced in 72 hours. Quick isolation of COVID-19 patients shall be ensured in treatment facility, and as intervention as prescribed, administrator surveillance for cases shall be carried out in health facilities or outreach mobile unit or through fever clinics in buffer zone. Awareness shall be created in communities on COVID-19 appropriate behavior. Then it shall be the responsibility of local, district, municipal authorities to ensure that the prescribed contaminant measures are strictly followed. State and UT's government shall ensure accountability of the officers concerned in this regard. Strict adherence to prescribed SOPs. All activities have been permitted outside the contaminant zone except for the following, which have been permitted with certain restrictions, like international air travel of passengers permitted by the MHA, and cinema halls and theaters with up to 50% capacity, swimming pools only for the training of support person, exhibition hall only for business to business purpose, social, religious, sports, entertainment, educational, cultural, religious gathering with up to minimum of 50% of the hall capacity with a ceiling of 200% in closed spaces, and keeping keeping of the size of the space in view in the open spaces, and however, based on their assessment of the situation, state or UT's government may reduce the ceiling to 100% or less in closed space. SOPs, standard operating procedures, have been prescribed for various activities. These include movement by the passenger train, air travel, metro trains, school, higher educational institution, hotels and restaurants, shopping malls, multiplexes and entertainment park, yoga centers and gym assemblies and other. For ease of these references, they have give an annexure to where all the SOPs related to the above said geographical areas were mentioned in Annexure 2, and the SOP shall be strictly enforced by the authorities concerned, who shall be responsible for their strict observation. SOPs for regulating travel in aircraft, train and metro rail are already in place, which shall be strictly enforced. States and UTs shall issue necessary guidelines for regulating travel in other modes of public transport, example buses, boat, etc., and ensure that these are strictly compiled. And there are national for the COVID-19 management that are specified in Annexure 1. Now, restriction. First, state and UTs, based on their assessment of the situation, may impose local restriction with a view to contain the spread of COVID-19, such as night curfew. However, state and UTs government shall not impose any local lockdown outside the contaminant zone without prior consultation with the central government. State and UTs also need to enforce social distancing in offices in cities where the weekly cases positively rate is in more than 10%. State and UTs concerned shall consider implementing staggered office and other suitable measures with a view to reduce the number of employees attending office at the same time, thereby ensuring the social distancing that have already described by Mr. Anil Kathad. And there shall be no restriction on interstate and intrastate movement of person and goods, including those for cross and border trade under the treaties with neighboring countries. No separate permission or approval e-permit will be required for such movement. Then protection of vulnerable persons. Persons above 65 years of age, persons with comorbidities, pregnant women and children below the age of 10 years are advised to stay at home except for essential and health purpose. Arogya Setu app. Arogya Setu app enables early identification of potential risk of infection and thus act as a shield for individuals and the community with a view to ensuring safety in offices and workplaces. Employers on best efforts basis should ensure that Arogya Setu is installed by all the employees having the compatible mobile phones. Organization and business entity with 50 or more employees are encouraged to avail the Arogya Setu Open API services, and this feature will facilitate organization and employees to return to work in a COVID-19 risk-free environment. District authorities may advise individual to install the Arogya Setu application on a compatible mobile phone and regularly update their health status on the app. This will facilitate timely provision of medical attention to those individuals who are at risk. Enforcement of the guidelines. State and union shall not dilute these guidelines issued under the Disaster Management Act 2005 in any manner. For the enforcement of social distancing, state UT government may, as far as possible, use the provision of Section 144 of the Criminal Procedure Code of 1973. All the district magistrates shall strictly enforce the above measures, and there are some penal provisions. Any person violating these measures will be liable to be proceed against as per the provision of section 51 to 60 of the DM Act 2005, beside the legal action under section 188 of the IPCC and other legal provision as applicable. The National Directive for COVID-19 Management. First, we should wear cover your face, and wearing a face cover is compulsory in public places, in workplaces, and during transport. Social distancing. Individual must maintain a minimum distance of 6 feet in public places. 2 गज की दूरी और मास्क है जरूरी, as said by our Prime Minister Shri Narendra Modi ji. And shop will ensure the physical distancing among the customer. Spitting in public places will be punishable with fine, as may be prescribed by the state, UT, local authority in accordance with its law, rules, or regulation. Additional directive for workplaces, already my colleague Mr. Anil Kathat has wonderfully explained all the guideline and the procedure, but in short, I'm just telling you what we have to, common practices we have to take care. For work from home, as far as possible, the practices of work from home should be followed. Staggering of work, business hours will be allowed in offices, workplaces, shop, market, and industrial and commercial establishment. Screening and hygiene, provision for the thermal scanning, hand wash or sanitizer will be made at all entry points, and of hand wash or sanitizer at exit point and common areas. Frequent sanitization of entire workplace, common facility, and points which come into human contact, example door handles, etc., will be ensured, including between shift. Social distancing, all persons in charge of workplaces, adequate distance between the workers, adequate gap between shift, staggering the lunch break of staff, etc. These are some slides related to the different SOPs that I've already discussed, and you can get different SOPs from these web links. So I have mentioned the web link here in the table format. Offenses or the punishment in a brief. First, punishment for the obstruction. Under the subsection 51, whoever without reasonable cause, like obstruct any officer or employee of the central government, or the state government, or a person authorized by the national authority or the state authority or the district authority in the discharge of his function under this act, refuse to comply with any direction given by or on behalf of central government or the state government or the national executive committee or the state executive committee or district authority under this act, shall on conviction be punishable with imprisonment for a term which may extend to 1 year, or with fine, or with both, and if such obstruction or refusal to comply with the direction result in loss of lives or imminent danger, therefore shall on conviction be punishable with imprisonment for a term which may extend to 2 years. Then punishment for false claiming. Whoever knowingly makes claim which he knows or has reason to believe to be false, or obtaining any relief, assistance, repair, reconstruction, or other benefit consequent to disaster from any officer of the central government, the state government, or the national authority, the state authority, or the district authority, shall on conviction be punishable with imprisonment for a term which may extend to 2 years and falls with fine. 3. Punishment for misappropriation of money or material. Whoever entrusted with any money or materials, or otherwise being in custody of or dominion over any money of goods meant for providing relief in any threatening disaster situation or disaster, misappropriate or appropriates for his own use or dispose of such money or materials or any part of thereof, or willful compels any other person so to do, shall on conviction be punishable with imprisonment for a term which may extend to 2 years and also with fine. Under subsection 54, punishment for false warning. Whoever makes or circulate a false alarm or warning as to disaster or its severity or magnitude leading to panic shall on conviction be punishable with imprisonment which may extend to 1 year or with fine. Offences by department of the government. Where an offence under this act has been committed by any department of the government, the head of the department shall be deemed to be guilty of the offences and shall be liable to be proceed against and punished accordingly unless he proves that the offence was committed without his or that he exercised all due diligence to prevent the commission of such offence. Then 50 under the 56, failure of officer in duty or his convenience at the contravention of the provision of this act. Any officer on whom any duty has been imposed by or under this act and who ceases or refuses to perform or withdraw himself from the duties of his office shall, unless he has obtained the express written permission of his official superior or has other lawful excuse for so doing, be punishable with imprisonment for the term which may extend to 1 year or with fine. Then penalty for contravention of any order regarding requisiting. If any person contravenes any order made under this section 65, he or she shall be punishable with imprisonment for a term which may extend to 1 year or with fine or both. Then offence by companies. Where an offence under this act has been committed by a company, body or corporate, every person who at the time the offence was committed was in charge of and was to the company or for the conduct of the business of the company as well as the company shall be deemed to be guilty of the contravention and shall be liable to be proceeded against and punished accordingly. Previous sanction for the no prosecution for the offences punishable under section 55 and 50 shall be instituted except with the previous section of the central government or the state government as the case may be, or of any officers authorized in this behalf by general or special order by such government. Then cognizance of offences. No court shall take cognizance of an offence under except on complaint made by national authority, state authority, the central government, the state government, and the district authority or any other authority, officers authorized in this behalf by that authority or the government as the case may be, or any person who has given notice of not less than 30 days in manner prescribed of the alleged offences and his intention to make a complaint to the national authority, or you can say the state authority, central government, the state government, the district authority, or any other authority or officer authorized as aforesaid. This is all about the provisions or if somebody violate the laws during the lockdown measures, as already mentioned in DISASTE Act 2005 from section 51 to 60. So please follow these provision and penalties. In general, I just want to share key last but not least, wear your mask properly, wash your hand with soap and water frequently, avoid touching sensitive part of body like eyes, nose and mouth, keep social distancing, clean surface regularly, 2 गज की दूरी और mask है जरूरी. दवाई नहीं तब तक ढिलाई नहीं. So we should follow all the measures and guidelines led by the government. So thank you very much.
Thank you, Dr. Kaur, for briefly sharing the recent guidelines that were released by Ministry of Home Affairs. Ma'am, there is one question for you.
Okay, sir.
What mental health and psychological support should be provided to workers during COVID-19?
Pardon, sir.
What mental health and psychological support should be provided to workers during COVID-19?
Okay, so during the COVID-19, as we know that it is associated with a range of concerns such as fear of feeling ill, dying, or being socially excluded, placed in quarantine, or losing a livelihood. Symptoms of anxiety and depression are common reaction for people in the context of COVID-19. Mental health and psychosocial support should be made available to all workers, and comprehensive risk assessment can help identify and mitigate related occupational hazard for the mental health, sir. So this is all about, and I have already discussed during guideline during my presentation. So this is all about.
Okay.
Anilji, I would like to
Thank you, sir.
NIMS has also started a helpline at the national level for psychosocial counseling. So they are also extending support for psychosocial well-being in the times of COVID-19 situation. So people can access the website of NIMS and they will get more details. Thank you.
Thank you very much, sir. Thank you, Dr. Kaur. Someone has asked how many districts came up with plan to handle pandemic. Actually, at district level, guidelines that was adopted by the respective state government as per the central government guidelines with some modification, or as such the guidelines were devised by central government is being implemented. Districts, I don't think in districts came up with any separate plans. They follow the law and rules of the respective state governments. And one about how the domestic workers can be helped to stand and overcome this emergency. Actually, domestic helpers also need protection, just like everyone else. We can provide them emotional support for those who lost their jobs, or we can help them financially, or we can help them to access the essential services. They should and also they should not be labeled as a virus carrier. They need our support in this time of crisis, and for humanity, we should treat them as our family. And
sir, there are a few questions, sir. I would also like to take, sir. Actually, there was one question from Sri Sanjay Kamli, where he has raised the question about the specific precautions that should be taken by the workers, construction worker particularly. So, like basic precautions at first that is implemented in all the sector we have already discussed. Apart from that, if you take particularly for the construction sectors, there are few things that that come to my mind. Like you should first of all you should notify your supervisor immediately as soon as you have symptoms, and please stay at home. Like if you have symptoms, and we should encourage that in our workers. And also the workers need to inform the supervisor if he is not sick but anyone from his family is sick, because most of the time what happens in those workers who are working in construction site, they are forced to, or most of the time they live in a very joint space in their house is very limited. So keeping in mind, they should also inform their supervisor if anyone in their family is sick, and they should try to not visit the workplace as soon as until unless this situation is resolved. Also, like we know that potential source of exposure include like contact in workplace, such as like touching different utensils, infected utensils, or you say the elevators or the vehicles. So such type of things, when you are touching, we should take special prevention, and also you should always cover your face. While working, also like cleaning and disinfectant, both, or you say the doorknob, you say the ladder, the probable toilets, the handrails, the other equipments that they use, they should try to use sanitize it, both, I think, at the beginning and at the end of each shift. We should promote this behavior of sanitizing both at the end and beginning of the shift, and also like workstation also. And also I think what apart from the worker, there is a role for the employer also, I think, which play a very important role. Like employers should have a like COVID response plan, like COVID-19 response plan, like we to workers, and your worker in a language like they will understand the most. And these employer, they should take like steps to reduce transmission, maintaining a healthy working environment, and also maintaining a very healthy business operations. Sir, apart from that, we also have, sir, I would like to take some questions from Onkar Puri, advisor DM. He has raised several very genuine questions, sir. So one of the questions were like, sir, what is done for the sensitization of NSS, NCC credits, scouts, and the chokidars? So I hope like it mean to say the role of NIDM in the above mentioned issue. So till date, there is no like webinar specifically for the NCC or the NSS credits or scouts or guides or the security officer or the chokidar. However, I would like to highlight that in most of the webinars of our webinars, we have participants from NSS or NCC credits, because I am also in contact with some of the guides, NCC guides, or I am in contact, and I am also a member in some of the groups. So I used to share the information, and you will be surprised to know that like even class for NCC credits of class 10 to 12, they are so enthusiastic, like they are so interested in attending the program. So we have a constant like participant from this side also. But there is no particularly like we haven't I must say, like it is an important suggestion also we would like to take in future program. And again, one more question was that whether deploying of ASA worker on or the health worker in the ground research from like door to door survey will have some impact, like whom to vaccinate first. Actually, about vaccinations, I think it is a little early to say, but I think recently everybody knows that the Delhi government recently conducted a like door-to-door survey of around 57 lakh people. And the objective of this survey, like it was to screen people, it was to like encourage more tests, and keep record of like high risk individuals, which include both elderly people, pregnant women, and also people with like co-mobilities and working in like government sector or private sector. So in that report, like an estimation of out of the 57 lakh people, around 14% were found to be like I think infected or symptomatic, at least suggests that and I think ASA workers, since they have that reach and that they have that knowledge, I think they can play a very important role in carrying out such type of research and door-to-door survey. And I think that much. Thank you. I cannot see any.
Thank you very much, Mr. Raju. And that's all for the technical session. Now we move ahead for our validation session, and for that I request Professor Surya Prakash, Head GMR Division and IDM, for his concluding remarks. Over to you, sir.
Thank you, LG. I'm sorry, due to certain reasons I cannot play video, but somehow I think a good contribution has been made by our speakers, who have shared very important information in terms of what is to be done and what not to be done for averting the incidents of COVID-19 and curbing their rise. as it is because of the changing climatic conditions and cold environment that is going on, and also the pollution levels rising because of condensation of the air during the cold winter periods. So they have also not only shared these informations which has been prescribed as do's and don'ts in COVID-19 situation at your workplace, at your home and other activities, but also shared the information that has been passed on to all concerned stakeholders by our Ministry of Home Affairs through the recent guidelines. I would urge that all stakeholders must adhere to the guidelines issued by Ministry of Home Affairs in undertaking all their activities. And as Honorable Prime Minister has also said, that still we have not been over with the COVID-19 situation. And we are still now in the third stage of getting the vaccine ready. So we should take all preventive measures to contain this disease. So just as Prime Minister said, जब तक दवाई नहीं तब तक ढिलाई नहीं. So we have to follow this and continue this till we get a vaccine. And prevention is always better than cure. So take adequate steps. A stitch in time saves 9. So all of the delegates, participants, they are requested to kindly follow with others as well, not only by themselves, because their family and other members or their friends, relatives should also follow it. That's why it requires a mass movement, and the Prime Minister termed it as Jan Andolan. So we must follow all those precautions and safety measures of the 3 golden rules and try to curb its spread as desirable in the communities. Citizens are the most responsible in terms of their contributions at the national levels, because until unless each citizen owns those responsibilities, we cannot make our country disaster free and resilient. So citizens and our communities, be it any, whether it is professional, social, environmental, or commercial or industrial, all have to work together hand in hand and try to control those disaster situations. So in this COVID-19, we had even seen other kind of disasters, including some of the fires which has been there. Even in COVID-19 hospital, we had one incident in Rajkot, and also cyclone Amphan and recently Nivar. So, and also some of the flood incidents have also taken place during the, as well as some of the landslides. So I ask that as envisaged in our national policy, we have to opt for multi-hazard approach. And while setting aside the impacts of one kind of disaster, we should not let any other kind of disasters to happen and affect us. So let's join our hands together, adopt a multi-hazard approach, technology driven, and work towards nurture the culture of prevention, preparedness, mitigation, and efficient response. With these words, I would like to personally thank the distinguished speakers who have shared their ideas and informations, and also all the delegates who have participated and made this program successful. With these words, I thank you on my personal behalf and on behalf of NIDM. Thank you very much, Anilji. Back to you.
Thank you very much, sir, for your concluding address. It is my privilege to extend the vote of thanks. At the outset, I would like to propose hearty vote of thanks to Major General Manoj Kumar Bindal, Executive Director NIDM, and Professor Surya Prakash at GMR Division NIDM, who is also the chair of today's webinar, for their supervision, support, motivation, and guiding us in our every endeavors. I also express a deep sense of gratitude to our speakers, Dr. Harjeet Kaur and Mr. Raju Thapa, Young Professional GMR Division NIDM, for enlightening the participant on COVID-19 appropriate behavior and latest guidelines for unlock that are released by Ministry of Home Affairs. I also express a deep sense of gratitude to all our participants without whom this webinar wouldn't be possible. In the end, I will like to thank IT team of NIDM, Mr. Balaji, Mr. Shobit, and Mr. Gaurav for their support in organizing the webinar. With these words, I conclude my vote of thanks. Wear masks, follow physical distancing, and maintain hand hygiene and help in flattening the graph of COVID-19. Thank you all. I request host to kindly end the meeting.
Okay, sir.